This brief sideshow is intended to provide nursing instruction related to basic transfusion therapy. The content of this educational video PowerPoint, along with the assigned readings in Pearson, will assist you in completing the Pass the Class assignment. Certain alterations in cellular regulation may result in the need for transfusion therapy. Can you think of any examples that may require transfusion therapy? Some examples of alterations in cellular regulation that may result in transfusion therapy include that massive blood loss following trauma or a surgical procedure, then acute or chronic GI bleeds, hemolytic anemias, that disorder in which red blood cells are destroyed faster than they can be made, anemia or thrombocytopenia resulting from cancer treatment, and then those critical medical conditions such as DIC and sepsis. Common blood products used in transfusion therapy include whole blood, packed red blood cells, platelets, and fresh frozen plasma. Whole blood contains packed red blood cells, platelets, and fresh frozen plasma. It's used in emergency situations to restore blood volume. Packed red blood cells are also used in emergency situations where the patient has lost a large amount of blood. It can decrease the risk of fluid overload in those patients because it contains less volume. It is missing the platelets and the fresh frozen plasma. It can also be used in patients who have anemia and who are symptomatic. Platelets are given to prevent hemorrhage in patients with thrombocytopenia or platelet function deficits. Fresh frozen plasma is rich in the clotting factors. It does not contain platelets. Fresh frozen plasma is indicated for bleeding caused by vitamin K deficiency and bleeding due to DIC. It is also indicated for the treatment of congenital deficiencies of a single clotting factor.